Okay, we are good to go. All right, sorry about the delay on that, guys. There did show up somebody was trying to get in, and apparently maybe I blocked them. Sorry, I'm not great at Zoom yet. This is new for me. We were using a different platform for all the classes we were teaching. Hopefully I didn't block that person out. But if you guys have it, we do teach classes every month, and I promise we're normally very on top of it, but we just switched over to Zoom because we wanted you guys to be able to interact and ask questions. We are going to be teaching classes about neck pain, headaches, migraines, elbow issues, hip issues, total knee replacements. I'm a physical therapist, by the way, at Rocky Mountain Therapy Services here in West Jordan. We've got 6 different clinics around Utah and 15 or 16 overall in our whole company. And as a doctor of physical therapy, we work on everything from head to toe. I've put a toe back in place and I treat headaches. So there you go, head to toe. And if you have something specific you want us to talk about or specific questions, then let us know. And some of the classes we've already taught are on our YouTube channel. So you can go and check those out if you find this information helpful. Today, we're talking about spine health and spine safety. So if you have questions or things that comes up, let us know. Bonnie, were you asking what my name was? My name is Brad Clementson. So, and then the other physical therapist here, his name is John Elmer. He was unable to join the meeting for the whole thing because we had a patient that we had to shift around. So he's helping with that patient, but he'll be popping in to say hi to everybody. John's awesome. You guys are going to love working with him. I know I do. So let's get into this. If you guys have specific questions, throw those in the chat to make sure we get those answered. Or if it's a question about where we're at right now, then just unmute your mic and join in and let's answer your question. So click this button here. The goals today, right there, that's everything that I want to make sure we cover. We can cover other stuff if you have other questions, but the main things we want to go over is getting your neck or back popped. Is that safe? And if it is safe, who should I have do it? Some of the other questions are, what is the benefit of getting it done? And just because it's safe, does that mean I need it, right? And then what are the different conditions that could benefit from using that as a treatment? So let's jump right into the safety. That's the big one today. Safety with this kind of treatment. By the way, I want to mention, if you want to learn other stuff for treating your back pain, for neck pain, what kind of stretches and exercises, stuff about posture, we do have a class we already taught, like I said, on YouTube, or we will be teaching that class again in the future. So make sure you sign up to join in on those classes as well. So as far as getting your neck and back popped or adjusted, is that safe? There are different problems that can occur from that kind of treatment, but the research that's been done on the safety is abundant. There's a lot of really good research out there. So some of the problems that can happen is the joints in your neck and back are called facet joints, and those can get aggravated just like a joint in your wrist or your elbow. The joints there can get aggravated, and if you're getting your neck popped and get those joints hitting each other, it can cause some pain or even injury, cause some inflammation. Or you could strain a ligament. So the ligaments are all over the place and throughout our body, but especially in your neck, you've got multiple ligaments at every single level of vertebrae in your neck. The other thing that can happen is a sympathetic nervous system response, where some people it'll be black and blue, or they get lightheaded, stuff like that. Now, as I'm talking about this, these aren't things that are happening all the time to every single person, and you'll see why that's important, why it's so important that we're talking about these things. Some of the ones that a lot of people have heard about, and just throw it in the chat or raise your hand if you're on camera, if you've heard of these things, but an arterial dissection or a blood clot, blacking out from getting your neck popped, and then afterwards you black out. Have anybody heard of that, or that's your concern? So far it's looking like no. So that's good. There are a lot of people out there. If you go to the ER with a stroke, one of the first questions they'll ask is if you had your neck popped by a chiropractor. I have a couple doctors, friends who work in the ER, and they've told me that's what they always ask. Some of the research shows that that can happen, but a lot of the research shows that the incidence of that happening is 1 in 10 million. So let's look at the research right down below here. Getting your neck popped is actually safer than taking ibuprofen. That's kind of interesting to think about, because would you even think about taking ibuprofen twice? You would just, well, I've got a headache or my knee's hurting, and you go and pop down a couple pills of ibuprofen. It's over the counter, right? So this study by Hurwitz et al. Reported the incidence for serious events with an NSAID is, let's see, my pictures are covering this. So 1 in 1,000 people. So that's not a lot. I mean, that is a lot, right? 1 in 1,000. You know, just in the state of Utah or Salt Lake Valley, there's thousands of people taking ibuprofen today. And so multiple of them are having these negative side effects. Whereas on the other hand, with getting your neck popped could be 5 to 10 cases of complications. Hopefully you guys can see where I'm looking. Right here's that information. 5 to 10 cases of complications for every 10 million who get their neck manipulated. Okay, so that tells you a lot that it's not super common. It also right here, the cervical spine surgery, on the other hand, right, instead of just popping my neck, let's get surgery. And 15.6 cases had complications out of every 1,000. So surgery, we all know, comes with more risks. It's more severe. You could have strokes, bleed out, infections, different things can happen. Sometimes surgery is necessary. So I'm not trying to diss on surgery, but this kind of shows you where that safety is. It's really safe to have this done. Now, let's look at the research on arterial flow, because that's the biggest one. People talk about getting a stroke or getting blood flow to the brain cut off. And when you take when you do manipulate the spine, the most strain that you could put on that artery when manipulating, per this study right here, and this is the link if you guys want to pull that up. It's just here on PubMed, which is one of the best sources for research. 1/9 of the required amount of force to damage the carotid artery for failure. That's how much force is applied when you're getting your neck popped. 1/9. You'd have to pop your neck 9 times as strong as someone normally does in order to cause that to happen. What's really cool about this research is when you're popping somebody's neck, they did a lot of studies here that took popping someone's neck and then took a physical therapist who just took someone and said, look over your shoulder, look over your shoulder. And then they measured how much strain was put on that carotid artery. And they found that it's exactly the same. So that's kind of interesting to learn, right? That tells you that there's not a lot of strain, because this isn't a lot, and popping, it's not a lot. There's no significant changes in peak blood flow. So that's how much blood is going through your carotid artery at any moment. There's no changes during or after getting your neck popped. So really, really safe. Any questions on that? Anybody still concerned? Is it safe? I don't know if I want to have it done. Stuff like that. What are you guys thinking? If there's no questions, that's great. Then we can just keep going. Okay. The other things we want to talk about are contraindications. These are absolute. Don't pop somebody's neck if this is a problem. So a CAD, carotid artery disease. So if they're already susceptible to problems, then we don't want to go messing around with the neck. An aortic aneurysm, they've already had a artery issue, then we want to avoid this, right? If you have tumors, a TB infection, if you have a fracture in your neck, I'm not going to be popping your neck, right? If you have cauda equina syndrome, so cauda equina is the bottom of your spinal cord, and if it gets compressed, then it can make where you lose control of your bladder and bowels, and it's very dangerous, and you should go straight to the ER, but don't have your neck popped instead of going to the ER. and excessive or extreme pain. I do have patients who have come in and they're just in tons and tons of pain, a 9 out of 10 pain, hardly able to move at all. We're not going to pop that neck on that day. Maybe in the future when we get the pain down to a 2 or we're doing a lot better, then we're going to be safer to do that. But don't, if you're like, I'm a 9 out of 10, I need to go see a physical therapist or a chiropractor to get my neck popped. That's not the right treatment. We need to do more conservative first and build up to that where that would be safe. And I love this last one. It's on the list. Lack of patient consent. Obviously, if somebody says, I don't want that done, don't go, oh, well, I don't care, and pop their neck. So that's really good to have on there. These are called relative contraindications. So this is the next part. This just means be cautious. It's a yellow flag. Is that you've got to make sure that you're being safe. Maybe we want to go a couple treatments without popping the neck right away. And it's something that, hey, you can still do it, just be cautious. So disc herniations, anybody had a bulging disc in your neck or back? Or you've heard of that, you know what that is. Maybe some of your friends have had that. That's something that you're still okay to do it, but let's take that into consideration. And somebody who's like, yeah, I've got like 4 bulging discs in my neck, that's not going to be our first treatment, is to pop their neck. If you're pregnant, you can get your neck and back popped. It's something that we've got to take into consideration and make sure it's safe for both the mom and the baby. Osteoporosis, that's thinning of your bones. RA, you saw rheumatoid arthritis was on the last list. That's an active rheumatoid arthritis. On this list, it's a non-active one. So take it into consideration. You don't want to flare it up or cause any problems. And there's a bunch of other conditions where degenerative disc disease, stuff like that, where we might have some considerations whether we're going to do that or not. And just talk with your provider. And if you still aren't sure, you could always get 2 providers, get 2 opinions. And anytime somebody comes to me and then they go somewhere else, get another opinion, I'm all for that. Okay, let's go through the benefit. Anybody have any questions on when to get it done, when to not get it done? Is it safe? We're okay there?
Would you pop it back if somebody has spondylolisthesis?
So I would. It would not be my first treatment. And if they do have imaging, then that would tell me how bad that is. So if somebody's a grade 3 or 4, then I'm not doing it. If they're a grade 1 or 2, they're really safe to have that done. Age also is a factor. If you have a spondylolisthesis and you're 85 years old, I'm not doing it. But if you're 20 or 25, 30, then it's a lot safer.
Or my son who's 16.
What's that?
Or my son who's 16.
Yep, we could do it with your son. That'd be fun. And that brings up a good question. People ask me or some of my colleagues often, what about with babies? In general, that's not the best treatment. There is the research still out on that. They haven't been able to prove whether it's safe or not. But in general, I'm going to stay away from that. And unless it's something like they really need it, they need, it's either surgery or pop the joint. But in general, that's something to avoid. Other questions? We're good? Okay. I'm using Bonnie as my gauge for if we're good to go. So the next one that we're doing here, benefits for getting spinal adjustments. Okay. There are a lot of really good benefits. You can reduce your pain drastically. If you've ever felt, I'm jumping ahead, I'll tell you about that in a sec. So increase flexibility and mobility of your spine, the spine joints, but also the muscles around it, which is awesome. Decrease stiffness in the muscles, increase shoulder mobility. How cool is that? So some people come in all the time and their shoulders just not getting better. You want to treat your spine and your shoulders move way better. And I've actually found it's the other way too. If I have no shoulder problem, but I've got a neck or upper back problem, work on my shoulder mobility and it helps my back. And then last, treat that feeling of being stuck. You're just like, oh, I'm just stuck. That I've got that stiffness or something where I just can't quite move. You get that pop and it's going to give you quick relief from that. And you're going to see later, that's not the only thing. Don't do that and good, I'm done, I'm ready to go, right?
So Brad, Bonnie had a question in the chat. When you say manipulation, are you talking about what a chiropractor does, or do you do massage treatment?
That is a really good question. So physical therapists, I like being a physical therapist because we're kind of everything. So we do massage, but we also pop necks and backs just like a chiropractor would. So when you're talking about manipulation, that's where you're taking the bones in the back and neck and popping them, right? The word manipulation is somewhat owned by the chiropractic community, but the treatment's the exact same. I've done the same training that the chiropractors have done to do and provide that treatment. Does that answer that question? So we do provide massage, but popping necks, manipulating or mobilizing, adjusting, whatever word you want to use to describe it. When you're popping a neck back, that treatment is what we provide here. And we're going to go into who to see in just a minute. Okay, I want to hear this. Anybody else have like, I feel stuck? Anybody else is like, yeah, I feel stuck sometimes, like or even you pop your own neck. Megan, have you ever felt that?
My kids pop their own neck all the time, and it kind of grosses me out.
Okay, what about knuckles?
About what?
Do they pop their knuckles too?
Yes. Well,
Okay.
no, I do that.
Oh, okay. So good, fun research on that has shown that that does not cause arthritis. But two things that it can cause. First, you can be addicted to that sensation and where you need it all the time, otherwise your fingers feel stuck. The second thing that it can cause is that you can damage the joint by, like we talked about earlier, slamming them together or strain a ligament from popping. So if I'm addicted to it, I'm doing it more often. If I'm doing it more often, I'm more likely to injure myself. Does that make sense? Hopefully we're good.
Yep.
Okay, awesome. All right, next one. Conditions that may benefit from this. Have you guys heard of second rib syndrome? That's where you get this pain right here in the upper back, kind of right by between your shoulder blade and your spine. That can be a second or third rib that's out of place. When you pop it back into place, plus you want to pop the upper thoracic spine, you do both of those. And the research shows that most people, so that's 95% or more, get better within 2 treatments, and that's it. So you got this shoulder knot, you're like, oh, I got all this stress in my shoulder. You pop that joint twice and then you're good. And it'll feel better, and for most people, never come back. Now, obviously, we can do some things with posture, mobility stuff to make sure it doesn't come back, but the research on that's really good. If you have misalignment of the spinal segments, I know we've all heard, I got popped back into place, or I got to adjust my spine because I'm out of place. Rarely, if you're in a car accident or you're a football player, then your spine might be out of alignment, but rarely is your spine actually out of alignment. Usually what we're dealing with is that you lack mobility in the muscles, ligaments, and joints. So the spine's in a great alignment. Maybe our posture is bad, but it's not like one segment is slipped out of place. Our posture might be bad. Our overall curvature of our spine might be off, but you're not popping to get back into alignment. You're popping to get more mobility. Immobility of the spine, acute onset back pain. If you have back pain that just came on out of nowhere without radiating pain down your legs, that is a really good time to get your back popped. If you have a lot of muscle tension, because popping your back releases the endorphins and gets those muscles to let go for a short period of time. Then we need to do some exercises to help with that. And we talked about headaches, migraines, shoulder immobility, stuff like that. So this is a really good treatment to help those. And there's a lot of other conditions I'm not even touching that it can help with. So consider getting it, have it a part of your treatment plan. Right here is more information. We already went over this. That is research. Okay, right down at the bottom, you can see I guess you can't see my mouse. Now you can. So down here at the bottom, you can see the researcher who did this research. 2 treatment sessions, 48 hours apart, and it only took those 2 treatments. And that's your second rib right there. So the pain is usually right here or slightly lower, okay? Now, this is my favorite part. Let's go over this. So who should I have this done by? I grew up with my dad popping my back all the time and it felt good, but maybe not the best answer. My dad, my spouse, my brother, friend, or Homer Simpson. So let's see if we can make this work. I think I can click on it. We're going to just watch a quick short clip. Can you guys hear? Let me know if you can hear the volume on this. Let's see. Okay. Am I sharing with volume?
It fixed my sciatica?
I don't know what to.
Can you hear that volume, Megan or Bonnie?
Now
Yes.
I can hear it, but when you first put it on, we couldn't hear anything.
Okay, it should work now. Let's see if that goes okay.
Can't hear it.
Okay, let me try again. Share sound. Okay, it should work now.
So, Homer, you think you can fix my sciatica?
I don't know what that is, so I'm gonna say yes. I'll go limp.
I'm limp.
1, 2, better not sue.
Hey, it worked. My searing leg pain is now a gentle numbness.
Next.
Yes.
So Homer Simpson's probably not our best option for getting your back popped. Don't just fall over a trash can or anything. If you guys haven't seen that episode, it's pretty funny. It's got your chiropractors in there and they come in and they get mad that Homer's trying to be a chiropractor. It's a great episode. So there are a lot of professionals who do pop necks and backs and are trained in it. And most people, the first person you think of is a chiropractor, and that's okay. But physical therapists also do it. DOs, so your doctors of orthopedic, your MDs do it, and neurologists do it. And I think there might even be a couple others that I'm just not aware of. They don't do it as often as physical therapists or chiropractors, so most people don't even know that they are trained in it or know how. And not all of them are trained in it. So they will only perform it if they are trained in it. So the answer, whether we should see a physical therapist or a chiropractor, the answer really is it could be either of them. What you want to do is find a good chiropractor or a good physical therapist. There are a lot of good ones out there. There are a lot that aren't so good. And the reason they aren't so good is because they lack these these portions of the treatment that I'm going to go through right here. So if you're seeing a chiropractor who's not giving you exercises stuff to do at home, or a physical therapist who's not educating you about your condition or whatever, those are not maybe who you would pick to go and see. So finding a provider, let me grab my pointer here. You want a provider who educates you about your condition and the full treatment plan. So is the treatment plan just getting your neck popped 3 times a week for 4 years? Or is there a full plan here? Are we doing more about this? Next one, are we doing unnecessary imaging? The Chiropractic Association put out a report in 2016 telling chiropractors, that's who they talk to, but really the whole medical field, don't overutilize imaging. With a lot of providers who will take an x-ray and then treat you and then take another x-ray to prove that it was helping because they want to sell it to you. That's x-rays are still radiation, right? And it's overutilization of that imaging, which isn't helpful for you, helpful for your recovery. And also taking an x-ray to prove to someone that they have a problem can be damaging. There's a lot of research we'll get to in some of our other classes, or if you want to know more about that, please reach out to me. But if we get MRIs or x-rays that weren't necessary, we're more likely to get surgery. Tons and tons more likely to get surgery that we didn't even need and we could have avoided. If we take x-rays of anybody over the age of 65, you have about 90 to 95% of people over the age of 65 have a rotator cuff tear. And don't quote me on that number. I got to look up the research for that. I didn't prepare for that information for this class. But the important thing to understand is we have torn rotator cuffs, we have bulging discs, but that doesn't necessarily mean surgery. And overutilization of that imaging is going to be harmful. Any provider you see should have a plan for you to be independent. If you're seeing a physical therapist 2 times a week for a year, or a chiropractor 2 to 5 times a week for 1 or 2 years, whatever the plan is, what's the plan to be independent? Can I get better faster with a different plan? You know, just popping my neck may not be a full treatment plan. And that's this next part. Does the plan include exercises and stretches? Those exercises and stretches you can do on your own. You don't need somebody babysitting you, holding your hand. As you get good at those and you've got a plan and you put it into your routine, you can become independent. And when we're strong and mobile, then you don't need to be mobilized or manipulated all the time. Some people might choose to go and get it done once a month or once every other month. My mom goes and gets a massage once a month because it feels good. That's okay. But we just don't want to rely on the one portion of the entire plan and only do that. And then also the most important part right here is you want to see someone who's not using too much force or too much range of motion. So with all the research that I read preparing for this class, the big indicator of increased occurrences of injuries, where it went from 1 in 10 million to 1 in 100,000. So it really increased dramatically. People were getting injured a lot more often, was if there was too much force, so a really strong manipulation, or they went instead, when I'm popping somebody's neck, I go 15 degrees just from here to here. But when in the studies, the research shows that it's way less safe if they go from here to here. So you can see that's a much bigger motion going a lot farther, and you're still doing it really fast. So how far they go, how hard they go is really important. So their technique is important. How do you know who's going to have the right technique? Well, go to a class like this and hear what they say about it. Or after a treatment and you felt like they really yanked you around too much, then that might not be the provider that you want to go back to and see again. John wants to pop in and say hi.
Hello, everyone. Hope that you're learning lots from Brad. He's a good teacher. Have a good evening.
Just trying to be as awesome as John. Okay, safest providers. Now this is where I'm gonna brag a little bit here. And once again, remember, go out and learn. Talk to your MD, talk to your chiropractor, talk to your physical therapist and learn what they say about it and make the decision for you. The research shows that physical therapists, and I've got the link here. Let me see if I can get my pointer down here in the bottom, right? The research shows that physical therapists are less than 2% of the injuries during all of these studies. This was a systematic review and they went and looked at all of these studies, and physical therapists had the least occurrences of injuries. So physical therapists who are trained in this, not all of them are, but those who are very, very safe. I was trying to find a study that I remember from grad school. I mean, it's been a while, so I couldn't find it, but it talked about how physical therapists only caused minor injuries when they did occur. That it was 2 in 3,000. And they were minor injuries, like a little muscle strain or something, as opposed to causing any major issues with a stroke or anything that could be more severe. So physical therapists are a really good choice. The biggest difference between a good provider who's giving you the right treatment is that full assessment. They use proper form and technique, so they're not overdoing it. And then the spine adjustment is just part of the full treatment plan. If that's all you're going and getting done and you have an injury, it's not enough. And if you don't have an injury and you're just getting it done once a month or whatever because you enjoy it, that's okay. That's different. But if you have an injury, it can't be the full treatment plan. These were just some images of mommy popping my neck, or here he pops his own neck and then he passes out. It's pretty funny. So there's a lot of good comedy about it. But with that being said, popping your neck and back doesn't have to be part of the treatment either. There are other things that we can do. A proper assessment, and I'm teaching you guys these things so that when you do end up in a physical therapist or a chiropractor's office and they're treating you, you have some ideas on what should you be expecting and what would mean you're getting the right amount of value. So proper assessment here reviews your whole medical history. It reviews the history of your current injury, collects information specific to that problem, assesses your range of motion and current limitations before doing any of these treatments. The clinician, the physical therapist, chiropractor should educate the patient about the risks and benefits. If they're shy to tell you, hey, there's a risk that you could get injured, or then maybe we need to see another provider. And once again, that's a choice you got to make for yourself. Adverse events could result from pre-existing pathologies. That's part of that clinician educating you. You need to understand, maybe I already have a blood clot. Maybe I already have a carotid artery disease, coronary artery disease, sorry. And we need to make sure we're getting tested, up to date with our physicals, with our primary care providers, so that we're aware of any of those pre-existing conditions. And then the full assessment should look for signs or symptoms of these conditions. So any of these pre-existing pathologies, anything that we talked about already earlier on about the contraindications, right? Some of those right here, I just threw on some pictures: spondylolisthesis and osteoporosis here. All right, treatment plan. The treatment plan should initially be to relieve pain. Let's get back to moving. Then it should be to restore motion and then improve independence. Every good treatment plan says you can do this on your own. Here's what you do, whether it's exercises, stretches, whatever that's going to look like. Okay, that is the entire thing. I know I went through that fast. Did we do okay on time? That was about a half hour, so that's kind of perfect. So what questions do you guys have for me? I went through all of those questions that we talked about at the beginning. What are we missing? What do you guys need to know?
This is Bonnie. I have a question.
Okay.
I am wondering, let's say we have pain or not lack of motion, but less mobility than what we want. Should we go first to our primary care physician and get referred to a physical therapist, or can we come straight away into you and have an assessment there of what the problem is?
That is a really good question, Bonnie. I have a somewhat complicated answer. The easy answer is yes, go see your primary care physician first. The complicated answer is, in Utah and many states in the United States, you can go straight to a physical therapist. So it's called direct access. The downside or the problem right now is Medicare specifically, but also some other insurances won't pay for treatment with physical therapists unless there's a referral. Now that referral could be from a chiropractor or from a dentist or from any medical provider, but you do have to have a referral for that to be covered. If you wanted to just pay cash, every physical therapist I've talked to has a cash price, and you can go and see the physical therapist paying cash and not get your insurance involved, and then it doesn't matter if you have a referral or not. What you can always do is call your insurance and ask them if they require a referral, or if they will let you see a physical therapist direct access. And physical therapists are doctors, and so we can do that assessment and keep you safe, so you're safe to do that. But it's just whether you need your insurance to cover it. Does that answer your question? Okay. Any other questions specific about neck or back pain? You want to get your neck or back popped? You've had it done and had a bad response to it, or maybe you had a good response you want to share. Anything else?
Well, here I am again. I don't want to share.
That's great. You're fine.
I recently had a procedure. I just don't know how much a person should say about personal procedures. But anyway, I had a pacemaker placed, and during part of the recovery time, a person has to wear an immobilizer. while one sleeps for about the first 2 or 3 weeks after that. I have decreased mobility in the shoulder, in the left shoulder. And it seems like it began with that immobilizer and some of the things surrounding that. So I'm wondering, okay, what am I wondering? Well, the things you've explained tonight, like we could be having a spine problem, but it's manifesting itself in the shoulder and that type of thing. But I'm just wondering, do you have any comment on the situation I find myself in?
With your immobility? So I do, there's a lot of things like you were talking about that can contribute to that immobility. Inactivity, being splinted, having braces, those can lead to immobility. The back can affect your shoulder mobility, and the shoulder can affect the back mobility. So we do want the treatment to cover both of those. But it doesn't have to be getting my neck and back popped. Now that might be part of the treatment depending on the assessment and making sure we look at all the contraindications. But there are stretches, exercises that you can do to improve your mobility, as well as making sure we're drinking enough water and putting ourselves in good postures. If we sleep with 5 pillows under our head, then that's going to put you in a poor posture. That's not going to help you with mobility, stuff like that. Does that answer the question,
Okay,
Bonnie?
and-
Or
Yes, it does, but you've led me to another question. If a
Great.
person is sleeping with if a person's sleeping with too many pillows, does that lead to the neck immobility? Is that what you're saying? Or I mean, to shoulder, can it lead to shoulder immobility?
Absolutely, it can totally contribute to that. Like I said, there's other factors. If you're in a sling for a long period of time, anything more than 4 or 5 days increases your risk of your shoulder getting stiff and having a hard time moving. It could even cause a condition called frozen shoulder. Your posture laying in bed, if we prop the head too far forward, and maybe you're a deep sleeper, then that's something to consider, to look at. Can we adjust? Can we lower ourselves down? Maybe if you have COPD, you can't lower yourself down. Then we've got to get some other plan to get you moving more often, or adjust, or make sure that we're supporting the back as much as we are the head. So it's definitely an individual circumstance, and propping the head too far forward pulls the shoulders forward and makes the shoulder more immobile. Even right now, just try this for me, Bonnie. Just roll your shoulders forward and slouch and try to pick your arm up over your head. It doesn't work, right? Look how that's as far as I can go. But now sit up, roll your shoulders back, and lift your arm. Way easier, right? So that's right there, your posture, your position that you put yourself in, that will change your mobility. But we got to look at other factors too. Drink enough water, and make sure you're using that range of motion. If you don't use it, you lose it. Any other questions, Bonnie? Oh, I did forget to mention, you asked about going straight to see a physical therapist. I don't know about other physical therapists near you. You did say you're in West Jordan. At our clinic, we provide free screens. So you can do a 10, 15-minute chat with a PT about your specific condition so that you know what to do. At that point, you're like, hey, I want to get treatment. Let's fix this problem. Then you go to your primary care provider and get a referral, and then go back to the PT.
Okay, I do have another question then. I have, several years ago, I went to your Cottonwood Heights one. I'm more out in Cottonwood Heights. I went to Paul. I
Oh,
think,
awesome.
Paul, is it Paul Wortley or Worley?
Yeah, Paul Wortley,
so-
he's awesome.
Okay, so what I'm wondering is, does he do that free 15-minute, what did you call that again? The free,
It's called a free
Screening.
consult, a
okay,
free consultation.
okay.
And that, I'm not sure if he does those. But totally worth calling and asking him. You can call over to, I used to know their number. I don't have it memorized, I'm sorry. But look up Rocky Mountain Therapy Services, Cottonwood Heights, just on Google, and it pulls up that phone number. Call and ask. Karen's at the front desk, and you can just ask her. Say, Karen, does Paul or they have another PT there named Jacob. Say, Paul or Jacob, do they do a free consultation so I can ask some questions?
Okay.
I put the number in the chat.
I
Oh,
remember
awesome.
Karen's.
It's in the, did you see that, Bonnie? So Bonnie, the number is 801. You got it? Perfect. Okay, and Paul is awesome. He's been a PT for a while and he's a spine specialist. So he's a really good one to work with. Any other questions? I think we're good to go. Bonnie, give Paul a call and hopefully that they can get you going on this and let us know how else we can help you. And remember, we teach classes every month. So just sign up for any of our classes. This next month is on dry needling. It's another treatment that maybe you haven't had done before. And if you want to learn about it, how it works and if it's safe. So just sign up for that class. All right, let's see. I need to exit out of this, and Bonnie, I'll see you next month. Maybe, there we go. Make host. Megan.
Yeah.
Do I need to stop the recording first, or do I just have
yeah.
you?
Yeah, go ahead and stop it.
Okay. How do I stop it? Pause recording, stop recording.